Hello everyone, I'm Dr. Tefi Debbie. I'm a consultant psychiatrist and a psychologist. I make videos on mental health education and personal improvement tips. The goal is to help demystify mental illness and provide you with self-improvement tips that will help you be your best and live your best. On today's video, I will be talking about how to handle or how to manage panic disorders. This is the third in the three-part series on panic disorders. Just in case you missed out on the first two videos on panic disorder, you can go on the Grace Hill Behavioral Health Services YouTube channel and look out for the part 1 and part 2 on panic disorders. Now, for treatment to be effective, there are 3 areas that the treatment must or should address, and it actually has to do with the panic disorder in itself. Number 1 is that treatment must address the cognitive component of the illness. When I talk about the cognitive component, I'm actually referring to the feelings associated with panic disorder and the thoughts associated with panic disorder. In the first video, I talked a bit about the kind of thoughts that are associated with panic disorder. I talked about the feeling of intense fear and the feeling of anxiety that is associated with panic disorder. Number 2 is that it must address the physical component of panic disorder or the physical symptoms. Also in the first video, I talked about the physical symptoms that you will experience in a panic disorder. So treatment must address the cognitive aspect, which is the feelings and the thoughts. It must address the physical aspect, which is the symptoms that an individual experience. And number 3, it must address the behavioral patterns or the behavior associated with panic disorder. Also in the first video, I talked about the 3 types of behavior associated with panic disorders. There are 3 treatment measures. Number 1, supportive therapy. Number 2, cognitive behavioral therapy. And number 3, medications. Supportive therapy is aimed at addressing life problems that possibly may have triggered the panic disorder or maybe maintaining the panic disorder. Cognitive behavioral therapy is the main therapy that is offered in management or in handling panic disorders. There are core components of a cognitive behavioral therapy that is designed for panic disorders. These core components includes the following. 1, education. As part of cognitive behavioral therapy, the individual must be educated about or informed or equipped with enough information about the nature of panic disorders. This helps to reduce and allay fears and allay the concerns and the anxiety associated with the symptoms. Number 2, it must involve monitoring, or otherwise called recording. Recording, and there are 2 major types of recording that occurs in the management. 1, recording of the symptoms in itself, which is called the panic attack diary. And number 2, recording of your mood. Remember I said that it's not uncommon to have depression coexisting with panic disorders. So the individual is expected to record his or her symptoms. Now, recording your symptoms helps you to give an objective guide to the process of treatment, and also helps you to know symptoms that are occurring, the patterns and all of that, because many times when you do not record, your mind tends to play out in a catastrophic way, saying that the symptoms are new, you never experienced them before. So recording is a critical and a crucial part of the treatment. Number 3 in the cognitive behavioral therapy is relaxation techniques. There are certain techniques that will be taught the individual struggling with panic disorder, particularly the deep breathing exercise and other relaxation techniques. This helps to reduce the panic attacks. Number 4, that is part of the CBT, is graded exposures. In graded exposures, basically, so it's a form of exposure to the fears, the thing that the individual fears and will cause some sense of panic, situations that may cause panic, So it's done in hierarchy. And when I say hierarchy, I mean from the least feared exposure to the greatest feared exposure. But that is part of the treatment process. And usually when that is done, the individual is taught how to relax while being exposed. Also associated, number 5, is behavioral experiments, where the individual is taught how to test some theories. So there are assumptions that when people start having panic disorders, they want to avoid, they want to escape, they want to feel safe. So test, and after a while, some of these assumptions that are wrong assumptions tend to form and become concrete, and they hold on to it as though it's the truth. So there are behavioral experiments that will be put forward to help you test these assumptions, and it's in the practice of them that helps you to break from the behaviors that maintain the panic disorders. And last but not the least, in the cognitive behavioral therapy that is offered for panic disorder is cognitive restructuring. Remember, one of the key components, it's your thoughts. In cognitive restructuring, the individual is just being taught how to reappraise situation, to challenge negative thoughts. Now, this is very, very important. All of these techniques, they go on, and the CBT techniques, they go on to help greatly in dealing with panic disorders. Now, finally, last but not the least, remember I said the first thing is, so there's supportive therapy, there's cognitive behavioral therapy, which is the mainstay of the treatment, and then finally medications. Sometimes panic disorders require people to be placed on medications. There are 2 major medications used in the management of panic disorder. The first are benzodiazepines, such as Lexotan, diazepam, and the likes. In some other countries, they use other types of this thing, but other types of benzodiazepines, but largely benzodiazepines are used, and usually they are used in the early phase of the treatment because they kind of give immediate relief. They are also called anti-anxiety drugs. So they help, they are quick, they are fast, and they give immediate relief. And then the second type of medication that's used in the management of panic disorder is antidepressants. There are a lot of them that are used in the management. So remember these 3 things, and this is how panic disorder is properly managed: supportive therapy, cognitive behavioral therapy, and medications. So there you have it. I hope you found these videos helpful, the 3-part video for panic disorder. Just in case you have not subscribed, please kindly go ahead and subscribe on our YouTube channel so that you don't miss out on any of the subsequent videos. Thank you.